Hello friends, Dr. Pranaya here. Last time we discussed how to use minoxidil for your hair fall or baldness. Today we are going to discuss about how minoxidil works in your hair fall and what all combinations that are available with minoxidil or what all substitute medications are there when you cannot use minoxidil. So let's see how minoxidil works. What is the mechanism of this medicine? Every medicine has its own nature. Minoxidil is actually a potassium channel opener which initially was used for treating hypertension. But who were taking tablet minoxidil, they were found to have hair growth. So this medicine was evolved to make it a topical preparation for the treatment of hair fall to increase the hair growth, and that is why minoxidil now is FDA approved drug for the treatment of hair fall and baldness. Coming to the mechanism of action. As I mentioned, it's a vasodilator, potassium channel opener. So it will increase the circulation on your scalp, which invariably helps in growing the hair better. When you have baldness or you have progressive hair fall in baldness, there is miniaturization. Slowly you find that your hairs are getting thinner and one fine morning you lose the hair. Miniaturization is a slow and gradual process. After using minoxidil actually reverses this miniaturization, so the hair fall reduces. Third, very important, it has little effect on androgen receptor activity. Baldness, or what we call as androgenetic alopecia, is actually a genetic problem where the hormone, the male hormone androgen, is playing role. Genetically driven androgen receptor activity is there on the scalp. Under influence of that, hair fall is happening. So minoxidil has effect on reducing the androgen activity on the scalp. Fourth, when there is a hair fall, the hair cycle changes. We have three stages in hair cycle, that is growing stage, which is anagen, resting stage, which is catagen, and falling stage, which is telogen. What happens in hair fall? The growth phase is arrested or prematurely terminated, and so the hair goes into the falling stage. At one point of time, when the falling stage is higher than the growing stage, you see visible hair fall. So what minoxidil does here? Minoxidil prevents the premature anagen termination. So the anagen phase prolongs and telogen phase stops. So the hair fall reduces. Fifth, minoxidil helps in resetting the hair cycle. Because when there is a hair fall or baldness, your hairs grow very slowly and your falling stage is high. So minoxidil helps in resetting the hair cycle in a way that the premature hair fall will reduce and your hair cycle will go into regularity. So these are the 5 mechanisms that minoxidil plays when you apply it onto scalp. Then there are a lot of formulations that are available from 2% to 12%. Initially, to start with, for men 5% is preferred and for female 2% is preferred. But if 5% is not giving good results, then we can go for the higher percentage of the formulation. Along with minoxidil, there are combinations that are available in different formulations like finasteride, aminexil, caffeine, procapil, capixil. These are certain formulation which comes along with minoxidil. What are the effects? Finasteride or aminexil, they have little effect on the androgen receptor activity. Procapil, capixil, anagen, these are all hair growth stimulator. So along with the mechanism of minoxidil, when you are adding some other component into the formulation, it increases the effect of the medicine also. So whenever you are using the medicine in combination, it is for the better effect and efficacy. Sometimes when you are not tolerating minoxidil, that is where we have to remove minoxidil and only go ahead with other preparations like capixil, procapil, anagen, certain herbal extracts. What are other conditions where minoxidil is useful? Other than baldness and patterned hair fall, minoxidil can also be given for any type of hair fall, including the hair fall where the cause is nutrition based or hormonal based. Even sometimes after chronic infection or inflammation, you start getting hair fall. Even in that case, you can use minoxidil, which we medically call as chronic telogen effluvium. There is continuous falling stage which is prolonged and growth phase is reduced. So these conditions also minoxidil is helpful. How it differs with the use of minoxidil in baldness or patterned hair fall and other conditions. The dose of minoxidil may be the same, but when it is for the chronic telogen effluvium, you have to taper it slowly and stop. But when you are using it for baldness, you have to continue the medicine. How do you know that minoxidil is working for you? And how do you know that you need to stop minoxidil now? When you are prescribed minoxidil with a particular strength, if suppose 5%, you have to use it for minimum of 3 to 4 months. If after using minoxidil for 3 to 4 months, regularly with a proper dosage 1 ml in the morning and 1 ml in the night, still you are not able to see good hair growth, then you have to make sure that it is not working for you. Then you can replace it with some other substitutes. A lot of people complain that after using minoxidil they lose hair. Why it happens so? As I told before, there is a hair cycle. After the falling stage only growth phase starts. So when you start applying minoxidil, by the effect of minoxidil, your telogen, that is the falling phase, is induced so that your anagen, that is the growth phase, can start. So initial 2 to 3 weeks you have the induced hair fall because of use of minoxidil to promote the hair growth actually. Thus you have to keep using the minoxidil once you are starting, even though you have visible hair fall at that time, it stops after the usage for after 1 to 3 months. The hair fall stops after using it regularly within 1 to 2 months and you get visible hair growth. We all know that there are different grades of baldness. Some people have very less fine regression of the hairline. Some will have only crown area which has gone bald. Some will have only thinning and some may have complete baldness with a smooth patch. So there are different stages of baldness. Minoxidil works better when there is early baldness. When you are just in stage 1 to 3, minoxidil is better. When to go for hair transplant again is determined on this factor. One of the criteria is you have to use topical solutions for a minimum of 1 year before you go for hair transplantation. So minoxidil is a preferred medication. If you are not tolerating, substitute it with any other formulation, but that medication you have to use for minimum of 1 year. After that, hair transplant can be done. Early treatment of your baldness or hair fall gives better results. If you have baldness which is more than grade 5, minoxidil may not help you. And what happens if you skip minoxidil in between? 1 ml per application of minoxidil should be applied on the scalp regularly. If you are using morning and evening, 2 ml is the highest dose. If you are using it regularly, there are certain changes that are happening into your hair cycle. If you stop it abruptly, definitely there is a trauma to that hair cycle and you get lot of hair fall. The influence of minoxidil onto your hair fall is such that it enhances the hair growth, but you are abruptly stopping the medicine, the hair fall will start again and there is a chance you may go back to the initial stage of hair fall. Thus it is advisable not to stop minoxidil. If at all you want to stop it, you have to slowly taper it and replace it with some other medication or substitute. Along with minoxidil, some cosmetic treatments can be advised, which includes platelet-rich plasma therapy, mesotherapy, laser light therapy or dermaroller microneedling. These treatments are adjuvant treatments. They cannot be the main treatment. You have to start using minoxidil and along with that, with repetitive sessions of the cosmetic treatment, you can improve the hair growth. But it should act as an adjuvant treatment only. Even after hair transplantation, do I have to use minoxidil? That is again a common question. So after hair transplantation, according to the Hair Restoration Society guidelines, minoxidil should be applied for minimum of 2 years. Because hair transplantation is advisable only on the bald area which is patchy. But when you have thinning or other areas which are yet to lose hair, you have to maintain that area by application of minoxidil. After hair transplantation, there is something called as shock mechanism. To prevent the effect of shock mechanism, minoxidil acts in a better way to prevent further hair fall and it arrests the progression of your baldness. Yes, it is a safe medicine. Only problem is you cannot stop it abruptly. So if you are compliant enough and you are motivated enough to use this medicine properly, then only you should start. But After regular use of minoxidil for 3 to 4 months, if you are not finding much results, then minoxidil is not the medicine for you. If you have any further doubts on minoxidil or any medication that you are using for your hair fall, you can put in your comment. Keep watching. Thank you very much.